to the next video on the Horsforth Dental channel. Today I'm going to be talking in detail about this book, The Dental Diet by Dr. Steven Lin, which I've read during the lockdown period. It's a really interesting book and I think it's a bit of a game changer. It has a lot of information about how dental disease is linked to systemic disease. And I really like this holistic approach to eating not just what we see in the mouth, but the whole body as one. One of the most interesting points of the book is that it seems to indicate that much of modern dental disease, and that's the big three, dental decay, gum disease and malocclusion, which is higgledy-piggledy teeth, all seem to have started at the same point in human history, and that wasn't really that long ago. It was the time of the Industrial Revolution. Prior to that, when we've looked at skulls of our ancestors, there isn't much dental disease, but suddenly 200 odd years ago, dental disease of epidemic levels. And what the author has a lot of evidence for is that this dental disease originated then because that was the initiation of the processed food industry, and it's these processed foods that have become abundant in our diet. That's one of the major causative factors to dental disease. We already know all the added sugar is contributing to dental decay, but the argument in this book is made that it's the things that have been taken out the foods that is also the problem. We were supposed to have a tough fibrous diet, and while we were kids this would be exercising our jaw. Now processed foods tend to be quite soft, and that loss of mechanical action is leading to underdeveloped jaws which are too small, and therefore there's not enough room for our teeth and they're crowding over. One of the features this book often alludes to is our relationship with bacteria. Now, previously within medicine, we've kept bacteria away. Bacteria is a dirty word, we don't want it anywhere near us, when actually we're finding out that the opposite is true. There is more bacteria in our bodies than there are human cells, and I really love that fact. And by nourishing and supporting a healthy population of bacteria, we know now that this helps make us much more resilient and less prone to disease. This fact has come up before. I read, and I think I've alluded to this book before. This is all about the bacteria, the microbiome, the garden of bacteria in our gut. It has dietary advice on how to support that. And now this book, The Dental Diet, focuses on the mouth, which is the top of the gut. Lots of dietary advice, but it turns out it's the same. If we're supporting the microbiome in our mouth, we're supporting the microbiome in our gut. The population, therefore, of bacteria within our mouths might help us explain a few anomalies within dental setting. For instance, when we have two siblings walking to the surgery, both with a similar diet, both brushing their teeth quite well, yet one always seems to get decay, and mum will say they've got weak teeth, and the other one seems to get away scot-free all the time. Well, that patient hasn't got weak teeth. What's going on there is the population of bacteria in that patient's mouth is less resilient. And when we can identify that, maybe we can encourage dietary changes, namely moving away from processed foods and encouraging a wide variety of natural foods into the diet. Maybe that will help the two siblings equalise in their decay rates. Such as the overwhelming abundance of dental disease, one of the problems is we've kind of normalised it. We now expect our kids to grow up and they may have one or two cavities, their teeth will probably crowd over, and when they're older we're going to remove the wisdom teeth. But we don't seem to do that with the rest of medicine. And so why are we doing it with dentistry? And part of the problem is I don't think, and I certainly wasn't taught what to look for. Often kids come into the clinic, they have bags under their eyes, their teeth are crowding, and they might be breathing through the mouth, and that always to me was kind of normal. That's just what we expect. Well, I don't really think that anymore. I remember on a lecture I attended a few years ago, this book came up. It's really interesting because a photographer has travelled the world and taken pictures of indigenous populations. That's relevant because these populations aren't affected by the Industrial Revolution. They don't eat processed foods, they eat the foods that they've eaten for hundreds and thousands of years. And when you look at their faces, they tend to be quite symmetrical. They're all breathing through the nose, and certainly the teeth are straight. Now, there may be a genetic component. I'm not saying that there isn't, but I think there's a lot going on with diet and nutrition here. All the information then from within this book is really powerful, because if we know what we're looking for, we can hopefully stop a chain of events later on. We know that kids presenting with underdeveloped jaws and crowded teeth and high palates, they are predisposed to conditions such as upper airway respiratory syndrome. Those patients in turn are predisposed to sleep apnea, and sleep apnea is a predisposition for all sorts of ailments throughout the body, from IBS and digestive disorders to neurological disorders and mental illness. So if we can get there early, way back when, just when we start to see things going wrong, we can hopefully prevent a cascade of events later on in life. So I'm just going to show you then what I had for breakfast, or an example of what I had for breakfast. But you'll see within this rather unusual breakfast bowl the abundance of variety and colour in there. Now, you don't have to test the chemicals there. You innately know that this is exactly what your body needs to be nourished. A human being is attracted to things of all different colour, and our hunter-gatherer ancestors, that's what they did. They chose things of different colour, they were attracted to that, and hey presto, they were the things meant to nourish us. Now, I'm a bit of a freak, so you don't have to have salad for breakfast, but maybe going forward I would encourage you to start building things into your diet. Start trying to improve your diet by adding fruits, fermented foods and vegetables, things that you wouldn't normally eat, and bit by bit, hopefully you will improve your well-being and your health. I really love this book. I've had a lot of fun reading it and doing this presentation for you today, and I'll see you next time on the Horsforth Dental channel.